There is an expectation at this point that I think is unreasonable. Um, I'll say what I think probably most Americans are thinking, but that nobody wants to say out loud. And that is that if an individual is not willing, does not choose to avail themselves of the ounce of prevention insofar as severe COVID sickness, if they don't care enough to avail themselves of that prevention, then I do not see why we should break our medical infrastructure, providing for that person the 40 pounds of cure that may or may not save their lives. I was this past week in a semi-tractor trailer waiting room with a bunch of other salt of the earth drivers, all wonderful men. And one of them piped up and said, "I'm not scared. I'm going to do what I want to do, and I don't want to get vaccinated." Another one pipes up, "That's right. That's the way it should be." And, you know, there's no one is forcing anyone to get the vaccine. If an employer decides that for his workplace, everyone there needs to be vaccinated, no one is being forced to. If a person who works there really believes, because they saw it on the internet, and if they couldn't put it on the internet if it wasn't true, really believes that if they get vaccinated, they're going to become a magnetized underground Martian laser lizard person, then that isn't the place for them to work. They need to go find a job that fits their beliefs, their convictions. I know of a delightful woman, very delightful woman. I'm afraid she has brain cancer. She went to the hospital because the symptoms of the brain cancer had become very, very difficult. 6 hours she waited in the waiting room, in the emergency room, because the place was absolutely glutted with unvaccinated COVID patients sucking up all the medical attention. I suspect most of the people in the United States feel like, hey, if a person chooses not to prevent, then send them home with some hydroxychloroquine. Send them home with some zinc tablets that have been blessed by a television preacher. Send them home with some ivermectin, and once they get home, they can repeat over and over to themselves, "It's mild. It's mild. That's okay. This COVID variant is mild." And when they have a harder and harder time breathing, they can take another ivermectin and see how that does for them. But do not go clogging up the hospital system if you've chosen not. Don't be expecting the cure if you haven't done the prevention. We can choose not to be vaccinated. We can choose to be inoculated. And that choice should determine whether or not we carry in our wallet a little card that says, "Please do not administer any hospitalized COVID treatments. I refuse hospital COVID treatments." I have a delightful young woman, young, most women are young for me now. This is a wonderful attention getting device for her. All of a sudden, people are paying attention to her. It's great. They say, "Hey, you need to go get vaccinated." "Oh, I plan on it, but I'm kind of busy, and life is really busy, but I'm going to, and my wife is very good friends with this woman. They talk very often on the phone. We've helped her one way and another over the course of years. But it's always the same thing. Well, I'll get around to it soon. I'm sorry. This beautiful young woman needs to carry a card that says, I refuse hospital COVID treatment. Now, of course, the first response to that is, hey, we provide treatment for people who smoke, and we provide treatment for people who are hurt on motorcycles, and everybody knows that smoking and riding a motorcycle is a higher risk activity than not doing those things. But we do not deny those people medical treatment on that in that case. This is different. First, when we use that comparison, please be aware that the first thing you're saying is not getting the vaccine is a high-risk behavior. But beyond that, the fact is, if you're going to use that illustration, then you need to realize that we all live, say we're talking about cigarette smoking, we all live in this cigarette smoke. It's just a question, say that we live in the 1940s and early 1950s when everybody smoked. Shoot, Ricky Ricardo and Lucille Ball and Andy Taylor, everybody smoked. Okay, my mother was the odd one out. She didn't, but my mother-in-law and father-in-law, my father, goodness, you could hardly see the television set from across the room. There was so much smoke in the room. Here's the deal. Say you could go to everyone who smoked and say, look, if you just get this shot, then you won't get emphysema. You won't get heart disease. You won't get cancer of the lungs or cancer of the mouth. All these things we know result from smoking more often and make it a higher risk. And if you just get this shot, you can continue smoking and none of those things will happen. Yes. Then, if a person came into the hospital with emphysema, clearly as a result of smoking their 2 packs a day and refusing the prevention that could have saved his life, then absolutely, that person needs to be getting a different level, a lower level of medical care than a person who was willing to do the right thing. The bottom line is, we have rights and we have freedoms. But as we determined during the Civil War and during the abolition phase, no one has the right to do wrong. It is wrong to promote the death of other Americans. It is wrong to say me, I, me, we, I, me, my rights, what I want to do. I want to live my life my way. Don't bug me. I'm going to do it. Me. No one has the right to do wrong.